Hi, my name is Sarita.
And my name is Rena.
We are both past patients with Mexico Bariatric Center, and we are here to break the stigma of having weight loss surgery in Tijuana, Mexico. We will be covering all things bariatric to help you get the most out of this weight loss journey. Welcome to episode 3, where we will be talking about the phase 1 and phase 2 of the post-op diet.
Yeah, so what's a post-op diet, Sarita?
It is a 4-phase process that transitions you back into eating normal food.
Okay, so how do we start that?
So the first thing that we're going to start is phase 1, clear liquids.
Yeah, clear liquid. That sounds scary.
We did clear liquids before surgery, and now we're doing it after surgery.
We did. And so what makes it a little different? Some sugar? You can have some sugar.
You can have some sugar.
Not like before, but
Right.
Yeah. And so what was the phase 1 like for you?
So I basically did water with the Mio drops right here, and I drank a lot of tea. Here's my example of tea. It is a herbal tea, chamomile, honey, and vanilla, decaf.
Yes.
And I would start my day with a big cup of warm tea to soothe my stomach and get my day started. So I also had broth. Really, those are the only 3 things I had.
Yeah.
I didn't really drink any of the other things.
Okay, so I probably drank a lot of different things. I did do more than one clear liquid post-op diet. So the first time I was like you, I really just did like mostly water. And I did a lot of the apple juice diluted. So like 60-40 diluted with water. That was really all I did the first time. The second time I went way more into it. So I did some tea like you. It has to be decaffeinated, of course.
Right.
I took some like packets, things like this, like the Gatorade, protein Gatorade, or I don't do Crystal Light, but I can't remember the kind that I took with me. Some kind of flavor packets. I also took broth packets with me. And I had some, well, I wanted to have some broth, but my stomach did not like broth that second go around. The first time though I did. The broth packets worked really well for that, but anyway, I kind of did a little bit of everything, I think, the second time.
I never really cared for the Gatorade and things like that.
One of my very favorite things on my second surgery with the electrolyte from Mexico. There are so many flavors of that.
Yeah.
There's so many flavors. There's a Sriracha flavor. It's like the best.
Yeah.
So I stocked up on that while I was in TJ. I like bought a lot of it from the pharmacy. But anyway, let's go into more about the clear liquids. When do we start clear liquids?
So you're going to start clear liquids after your leak test in the hospital. When they do your leak test, then you are able, and you pass your leak test, you're able to start clear liquids. So you're going to count that technically as your first day post-op, because you're going to count each phase is 5 to 7 days. So you're not going to count the day of surgery. You're going to start from your first day of liquids.
And for most people, that is the day after. Not always. I think in some
bypass, it's
some strange cases, it may be 2 days after. But for most people, you do that leak test and start drinking on that second day. So that is day 1, technically, of your post-op diet, not from the day of surgery. Okay, that makes so much sense. So much sense.
And it's very important to track your fluids.
And so what are some good ways to track your fluids? How did you do that?
I just kind of measured mine, like I had a cup, and just, kept track. I know they do sell like water bottles that have 64 ounces, and you can measure it that way. There's all kinds of ways to measure it.
So how did you keep up with it, like on the daily? Like, okay, so now I drink 10 ounces. And
I had an app I was tracking.
Okay, do you remember which app you used?
I want to say that it was called My Plate.
Okay, I have not heard of that.
So that was 5.5 years ago when I had surgery. That was the app that I was using. A lot of patients use Bariatric or Bariatric Pal.
I love Bariatric. That's my go-to. That's exactly what I was going to say. Yeah. I like it because you can set reminders to drink your liquids. Drinking your liquids during the post-op clear liquid phase is not as hard because you haven't really resumed normal life. So it's like the only thing you really need to be thinking about is sipping.
Right.
So
sip all day.
Sip all day. People say, how do I get 64 ounces of liquid in?
Right.
You just literally sip it all day and it will happen.
Yep, it will happen.
It will happen.
A lot of patients ask what to drink, so we do have some examples here.
We do.
And so we did go through some of these. We've got some protein drinks, got the apple juice, water with drops, the tea, the broth. So I like to tell the patients to try them at different temperatures because sometimes cold is not going to work for someone and hot may feel better or warm. You know, like for me, the tea was very soothing going down and it felt good for the rest of the day.
Yeah, and you know, it was the same for me, and I can say that I was kind of both ways because my first post-op diet, warm was great. It felt so good. It was soothing. It was wonderful. And the second post-op diet, I remember the first time I made myself some broth with the broth packets. It was so just like I didn't like it at all. And the first time I preferred cold. Room temperature, I should say. And the second time I liked cold. So like I bought the electrolyte, like I said, and it was really good, really cold. I really liked that. And these are examples. People ask us all the time, like, how can you get in all that? What can I drink besides water? There are options. And all of these things have a different purpose. We tried to pick some different things for different reasons. So some of this is for flavor. So like water with flavoring or just water. That's a flavor. The apple juice is just for flavor. It's not really, it serves no purpose. Of course, electrolyte itself is going to help you with keeping hydrated. It is a hydration tool, right?
Yeah.
And then the
protein.
The IV in a bottle is also good for hydration. And then there's also, I see a lot of people really like that liquid IV. And you can get liquid IV, I think they sell them in bottles, but also in the flavor packets.
Right, packets.
And so, to me personally, I really like this IV in a bottle, like the melon flavor particularly, it's really good. And then what about the protein?
Right, you can do the protein, you can start drinking protein water on clear liquids, and that will help you meet two goals, getting in protein and your fluids. And you want to be careful. This one has caffeine, so you don't want to do caffeine quite this early because it will dehydrate you. So this is an example of what not to get. No energy.
Protein 2.0 without without the caffeine, because there is a difference. But the protein 2.0 that does not say with energy is a good source.
Right. And you know, even the Mio drops, some have energy. These are plain over here, but you don't want to do energy because the caffeine will dehydrate you.
Yes. You still want to stay away from caffeine until you are getting in all, 110 ounces of liquids a day. Once you're resuming that, once you are consuming, once you're consuming 110 ounces a day, then you can resume caffeine.
Right.
And that, because people always ask, when can I have my coffee? When can I have coffee again?
I waited 3 months to do coffee because I wanted to make sure that I was completely healed and I didn't want to get dehydrated.
Yeah. And so if you're trying to get in your protein when you're on the clear liquid, you can also always add in something like Isopure, Gen Pro, that flavorless whey protein. Those are all good things to add into any of these clear liquids that you want. And then dehydration is an important thing with this phase. And so if you're feeling shaky, if you're feeling like real jittery, if you feel dizzy,
like
disoriented, nauseous, those are all signs of dehydration. And that is where things like electrolyte, Pedialyte, the IV in a bottle, anything like that is going to come in handy. It's super important. You can also always visit a local IV bar.
Right.
We have seen, I personally have never done that. Have you?
No, I have never, but I do tell patients all the time, if you have one near you and you feel like you need it, go there. Or sometimes they have mobile ones that will come to you. But, you know, if you have it and you can, you know, get there and do it, do it.
If you're not sure what that is, you can always reach out.
Right.
We'll be glad to explain more about it, or just Google
or Google it.
Google IV bar
near me.
And you'll find them. They're kind of all over the place.
They have popped up everywhere.
They really are. IV hydration, anything like that.
Yeah, health spa.
Most health spas have that. They do. Yeah. And then there's a couple of things you can do during your clear liquid phase to kind of help with reflux.
Right.
So some people have reflux, some don't. Some have nausea, some don't. I always tell people that if you are feeling any kind of nausea while you're still in Tijuana, buy Extra Plus Gel.
Right.
Because you can't get that in the US.
No.
Some people will say that the Maalox Plus is the same thing, label to label. But if it worked for you, then Maalox Plus don't work for you, then you will argue that it's not the same thing.
Oh yeah, I didn't have Plus Gel.
Yeah. And so what are some things that you can do?
So what I did, I took the omeprazole first thing in the morning on an empty stomach, so it would coat my stomach all day. However, I did not have acid reflux before surgery or after. I just took it as a preventative. And now we suggest doing that and taking the Plus Gel as needed during the day as a preventative.
Can I be honest?
Yeah.
I didn't do any of that.
Oh, okay.
I didn't do Plus Gel or omeprazole, but you know, I didn't need it. I didn't need it. I didn't have that reflux concern. I didn't have. Maybe I should have done it as a preventative, because if it.
That's why I did it. I'm like, I just followed the rules, and I'm like, well, it says to take it, I'm taking it.
It does, but I skipped that.
Yeah, a lot of people skip it, and then they start taking it after I talk to them, and then they're like, oh, I feel 100% better. So
if you do skip it, and you are feeling some discomfort, it could be reflux. Sometimes you'll feel something stuck in your throat, stuck in your chest, and you're like, oh, there's something wrong with my surgery. It's just probably reflux.
You're gonna have a lot of stomach acid. Yeah,
things like that. All these things you want to keep an eye out for. You can also always, as our patient, reach out to Jen, our surgeon liaison, of course the nutritionist, and Jen, if you're not sure if it's reflux or a complication, you should have her contact information. If you don't, anybody in the office can get it to you. And then, so medications. You mentioned taking omeprazole. So omeprazole is a pill, right?
It is a pill.
It is. And I think omeprazole is a capsule.
It's like a little tiny, I don't think it's a capsule. I think it was like a little pill.
I think mine that I've had before
maybe
are capsules.
Yeah.
I mean, I'm sure it comes in all forms.
Yeah.
So, oftentimes people ask us, how do we take our pills?
Right.
And, so you take them as prescribed, unless they're restricted, and they'll tell you at the hospital if they're restricted. But unless they're restricted, you are going to take your pills as prescribed. And it's not hard. Do not crush your pills.
No.
Don't open your capsules and pour them out.
No.
Take them exactly as you've always taken them. If you have a lot of them and you're struggling to take the pills, then what you want to do is take 1 or 2 at a time with like 1 to 2 ounces of water. Wait 60 seconds. Try it again.
Right.
You know, do it again until all of your pills are taken, and you just want to repeat that until you get them all down. Right. Does that make sense?
Yeah. Absolutely.
All right. And so, anything else in clear liquids? Like anything we haven't talked about with clear liquids?
I don't think so. I mean, my best advice is track your liquids.
Track it.
Track them.
Sip, sip, sip.
Sip, sip, sip all day.
You know what? Straws. Can you liquids with a straw?
You should not.
You should not.
It's not recommended.
And why not?
Because it can cause you to have gas pain in your stomach, and
how are you gonna know if it's like gas pain or like
pain?
You're not gonna complication
know.
pain.
You're not gonna know.
I mean, complications are like extremely rare. Like less than 1% of patients have them. But if you're drinking in a straw and you're trapping gas in your stomach and you're having some discomfort,
you're not going to know what's causing it.
So you will find all kinds of things on the internet about drinking out of straws or not drinking out of straws. And so our surgeons specifically say do not drink out of straws the first at least 8 weeks, because you will not know if you're having gas pain from the straw or if you're having complication pain. So if you are persistent and you want to drink out of a straw, just know that you could be causing yourself some discomfort. And if you are having that discomfort, then stop using a straw and see if it goes away.
Who wants to be in pain?
I'm a straw user.
I'm not a straw user.
I am. If I don't use a straw, it ends up all over me. I don't know why.
I drink with a lid on my cup. So
I tried that, but it just like pours out the side of my mouth.
It makes it to my mouth.
I don't understand how people drink without a straw.
It does.
I can't do it.
Yeah.
I just can't. It doesn't make sense to me at all. So that really kind of wraps up the clear liquid phase. That is 5 to 7 days.
So it's recommended to stay on each phase 5 to 7 days. However, you may meet your goal and move to the next phase at 5 days, or it may take you longer to meet your goal and you may stay on longer than 7 days. You know your body, and only you can, make that decision. Your goal is 64 ounces of fluids. Like, you have to meet that goal to go to phase 2, because you have to get 64 ounces in phase 2 in addition to thick liquids, which we will get to next.
So in your phases specifically, did you do you feel like you advanced like right on time? Like how did you transition?
So I did the full 7 days. Okay. Because I was terrified to move any sooner than that, although I was meeting my goals. So I just did the whole 7 days just to be on the safe side.
So my first surgery, I feel like I phased through early on. So like if it was like day 5, I was counting down the hours to have a protein shake.
Well, I was counting them down for 7 days.
So I was like so ready. So on the second surgery though, I was really trying to just get the most out of it. And so I went the max. Like I would go like the whole 7 days. And it helped too that I was out. We stayed in California after my second surgery for a little while. And that helped because I had like this great big stock of electrolyte, the horchata electrolyte from Mexico. I tell everybody they got to try that. Cold, it's so good. But it might not be good to you cold or hot. But to me it was great. And so I had like a great stock of that, and they have so many flavors. Like in the U.S., we can get the electrolyte. It's usually in the
not the same
flavors, like the Mexican food section. But we have limited selection of flavors. In Mexico, they had like, I want to say 20, but that's over exaggeration. Yeah. So anyway, but I kind of did both. I did like the early on, and then the whole maxing it out for me. But so finally it gets to phase 2. What was phase 2 like for you?
Phase 2, thick liquids.
Yeah.
Like 2 protein shakes a day, and then you get to try some other thick liquids.
Yeah.
Yeah.
So what are our goals in thick liquid phase 2?
So your protein goal is 60 to 90 grams of protein per day. Shoot for the high number.
And as you mentioned, you want to get in your 64 ounces of clear liquids and then add in your protein shakes. Or other thick liquids, because there's other things other than protein shakes, but thick liquids are a meal. Whether it's a protein shake or a yogurt, a Greek yogurt,
or oatmeal, high protein oatmeal.
Yeah, they're all meal. Protein shake is considered a meal, so you want to stop drinking your electrolyte and wait 30 minutes before having your protein shake or your yogurt or
bean soup.
Or your bean soup. Yeah.
This is
Pureed.
Yeah, purees.
Yeah. So many options. And just make sure you treat it as meals. So you want to wait 30 minutes before and 30 minutes after.
Right.
And then, like you said, with protein, you said 60 to 90 grams.
Right. A day, per
A
day.
day.
There's a lot of reasons for that goal. Part of it is your internal healing.
Mm-hmm.
It also helps keep up your muscle mass, so that really shoot for the higher number if possible.
Mm-hmm. Which would be like in the 90 gram range.
I mean, the protein just keeps you full too.
Yeah.
So.
And you know what is a great trick? I love tricks and tips, right? A great tip, great trick is if you add the Gen Pro or Isopure, I want to say, don't quote me on this, it has about 15 grams per serving.
I believe so.
So it's somewhere in that range, and different brands may vary, but if you add in a unflavored Gen Pro to a protein shake that already has 30 grams. So like the premier protein shakes have 30 grams of protein. And so if you add, that's like 45 grams in one meal.
Yeah, that's half your protein.
Okay, and then you drink a protein water, right? And that's going to have what,
20.
Like, yeah, so look at you banging out protein goals all day. It's easy there. People want, sometimes feel like they don't know how to meet those goals, but there are ways. There are ways. It's not ideal to supplement your protein. You really should get your protein as much from food as possible. In this phase where you're just drinking a bunch of stuff, supplements are your friend.
You're still healing. And
yes.
Yeah, you're not going to obviously be able to get it from food.
Right. So supplements are your friend. Supplement as needed and get those goals in because it is super important. And so we've already talked a lot about different types of thick liquids, but just to, what are some thick liquids? So when we're talking about like yogurts and soups, and what do we want to look for in a soup, for example?
So for soup, we really want to look for like a bean soup, and this one is a bean and vegetable soup, and it's a really good one.
Amy's Organic.
Goya has a black bean soup. You can puree it. You can thin it out with some more chicken broth or beef broth, whatever you prefer. So it's a consistency that would fit through a straw, but you're not drinking it through a straw.
Right.
No tomato-based soup because of the acidity.
Tomatoes.
Yeah. Cream-based, no cream-based. That could also cause you to be gassy and bloated because it's cream-based dairy.
From the dairy.
Right. So, and no starchy soup either. So really kind of...
So stay away from things like potato.
Right.
Or like corn. Well, you wouldn't want to do corn because corn just don't
like a corn chowder.
Yeah, that corn's not gonna.
No.
You don't want anything with chunks because it could potentially get stuck like in your staple line.
Yeah.
Yeah, you don't want that to happen.
So you can do Greek yogurt. It's considered thick liquid, natural applesauce.
Yeah, so with Greek yogurt, if you have it and it's a little bit too thick, you can thin it down with something like almond milk
or coconut milk,
unsweetened almond milk,
unsweetened.
and coconut milk.
You can do a high protein oatmeal, thin it out a lot with, again, unsweetened almond milk or coconut milk.
Or a protein shake. You can thin down oatmeal with like a vanilla protein shake.
That would give it some flavor and more protein.
More protein. And you know, I also made oatmeal with the Isopure, like the Gen Pro. So I added that into the oatmeal. So I had like I made my own protein oatmeal. So to speak.
Right. And they do sell instant oatmeal that's high protein, but you know, like
again, if you supplement, and it already has it in it, and you supplement some extra, you're getting in your goals.
Right.
And then also, one of the things that I like to do on post-op thick liquid was really chill my protein shake.
Like a slushy?
Yes.
Okay.
Yeah. Because I really like cold.
Right.
I really like cold.
Right.
So like throw it in my Yeti cooler even.
Right.
And get it really, really cold. It was just really good.
Okay.
And I could drink it that way.
Sounds yummy.
It was yummy.
So that kind of wraps up phase 1 and 2 of the post-op guidelines. And in our next podcast,
We will talk
episode 4,
Yes.
we will talk about phase 3, soft solids, and phase 4, solids.
Yes. And some yummy things to try.
Yes.
Oh, yeah.
And some tips.
Yes. Bye.
Bye.
If you have any questions or want to share your bariatric weight loss journey, you can call or text us at 480-999-4826 or send an email to podcast@mexicobariatriccenter.com. You can also follow Mexico Bariatric Center on Facebook, Instagram, and Twitter. Keep in mind, these are the opinions of the host. The views represented do not reflect or define the values of Mexico Bariatric Center. This podcast is sponsored by Emerge Bariatrics and Mexico Bariatric Center. Please visit mexicobariatriccenter.com for more information.